everybody, it's Adam with HeartValveSurgery.com, and today we have something very, very special for you to see and learn from. I have, as a patient, experienced highs and lows. Before surgery, you have concerns and doubts about what is going to happen with your valve disease, how surgery is going to go, and what's the recovery going to look like. And to showcase how great life can be after a heart valve surgery, I want to bring in Alan Stendahl. Alan, are you there?
I'm here, Adam. Good to see you.
Great to see you too, Alan. Thanks so much for being with us today. Alan, I can't thank you enough for spending some time with us here, having this discussion. Let's tell the folks a little bit about your background. Alan, you're 73 years young, look fantastic. You're living in Fernandina Beach, which is near Amelia Island in Florida. I understand you're retired from a wonderful career in commercial insurance, and now you are an avid golfer. You've been married for 30 years, if I understand that, and you have 3 wonderful adult children. How did I go in terms of your timeline of life, Alan?
You got it perfect, Adam.
Great. And what brings us together
in various parts of the country, one in New York City, one in San Francisco, and one down here in Sarasota, Florida.
Yeah, and so Alan, there is, I've got a ton of questions that we're going to get to, but I want to start with just this overwhelming fact, and I'm going to let you share the good news with all of the members in our community. Alan, how long has it been since you had your heart valve surgery?
It was October 19th, 1982. I remember it like it was yesterday.
And I'm not great at math, but I'm going to take a guess and say that's about 37 years. Is that correct?
Correct.
Wow. And so, Alan, the other question is, have you had any additional operations for your valve since that time?
No, I've not had any issues with my valve. I've had no hasn't required any additional surgeries, which was one of the things that I was most pleased about when I first learned that I was going to have a mechanical valve implanted instead of a tissue valve.
Great. And Alan, let's start now with some of these questions that are going to lead up to the valve you selected and kind of what your life has been like since. I understand that you were first diagnosed with heart valve disease when you were about 9 years old, and that's going back to 1956. Is that correct? And can you share with the members of our community what happened?
Yeah, when I was 9 years old in 4th grade, I was diagnosed and began treatment for rheumatic fever, which wasn't uncommon back in the 50s. It wasn't a common ailment, but it wasn't as uncommon as it is today. I was confined to bed for 3 months, which was hard for a 9-year-old to be. But the result was as it often is with rheumatic fever, the result was a damaged valve. And they learned that almost immediately post-surgery. And so I've been under doctor's care for this murmur or damaged valve ever since.
Right, and so that happened when you were 9. I understand when you were 19, you got a full workup done. And what did the doctors learn when this is back when you're in, if I understand it right, this was in Madison, Wisconsin. What did the doctors find out when they did this extensive workup on you?
Well, I went to the University of Wisconsin hospitals in Madison, Wisconsin, because we were living in Wisconsin at the time, and they did a complete 4 or 5 day workup. And the phrase that I most clearly remember from their the results of their testing was that I had aortic insufficiency with left ventricular heave. Now the report went on and on from there, but those were the words that have always stuck with me.
And Alan, for the members of our community out there, or anybody watching this, patients, caregivers, medical doctors, who knows, aortic insufficiency, that means that you had a leaky aortic valve, is that correct?
Correct, that's right.
And then the doctors went ahead and you went into what we hear here all the time is watchful waiting into your 30s. So for the next 11 plus years. And then what happened?
Well, as you say, I was under, that's when I began being under the care of a cardiologist in addition to my primary care physician. And I would visit with my cardiologist at least once a year from, throughout my 20s and early 30s. And as part of that examination, he always performed an EKG. And things were kind of rocking along just fine until the spring of 1982, when they noticed a significant change in my EKG. I don't remember specifically what they said the issue was, but I do know that they felt it was serious enough where they thought I should have an echocardiogram, which I hadn't had up to that point. So they scheduled an echo for me, and the echo confirmed that I did have, it confirmed what the EKG had indicated. And so they then decided I should have an angiogram. So they scheduled that for the summer of '82, and I had the angiogram done. And after getting that done, they took the results of that and discussed it with the surgeons, and they decided that the time was right, and were recommending that I have the valve replaced.
And this is, as you know, Alan, as I know, as a patient who's been through, this is a really big, important time for you. You're faced with a life-changing decision, and you have these options that maybe you have and maybe you haven't considered before. And that valve replacement choice could be something like a cow valve. It could be a pig valve. The other alternative could actually be a human donor valve, a homograph. Patients can select a Ross procedure, and there's the option of the mechanical valve. Obviously, you went down the path of the mechanical valve. Can you tell me what it was that excited you about the possibility of having a mechanical valve?
Well, the obvious answer is when I heard that with the mechanical valve, even though they were still relatively new, I mean, mechanical valves have been in use for 25 years, I suspect, but this particular valve that I had implanted, the St. Jude valve, had only been used since 1977, so it had been a little less than 5 years. But they told me that their hope was that with the mechanical valve, it would last a lifetime. Of course, they couldn't say for sure that it would, but when I heard that's all I needed to hear. I was happy to have the mechanical valve, knowing that even though I would have to have, be on blood thinners my entire life and have my INR checked on a regular basis, that was a small trade-off for not having to have another surgery somewhere down the road. So we opted for the mechanical valve, and 37 years later, here we are.
Wow, amazing. And you brought up a really interesting point, Alan, was actually several points. The durability of the valve was attractive to you. The possibility it was a one and done scenario for you. The other thing that you brought up was the use of blood thinners to prevent the potential clotting on the valve over your lifetime. I've got to ask you, has it been difficult for you to be on anticoagulants to prevent any kind of clotting on the mechanical valve?
No, it hasn't been a burden or a nuisance at all, Adam. It's something I've gotten so accustomed to having on my calendar. When things are going well, that's only once a month. And even if I get out of range a little bit, I may have to go back and after they adjust my medication and go back in a couple of weeks to have it rechecked. But for the most part, it's always, month after month, one time a month, and it hasn't been a burden at all.
Fantastic. And so the big question coming out from me is when I talk to patients who've had the procedure, and it's all procedures, I'm really curious to know about their quality of life. This disease can be so debilitating. It can be so insidious that it can really wither you down without you potentially even knowing it before you have a procedure. And what I'm curious to know is, Alan, how have you been doing these past 37 years? Can you share about the impact that this procedure has had on you and your life?
Well, if you would have asked me that 3 or 4 years ago, Adam, I would have said I've been great. I had absolutely no issues for almost 35 years. I had little or no restrictions on my activities. Even after I had the surgery, I resumed playing fast pitch softball for a couple of years, and then my passion turned to golf along with my wife, and we're avid golfers. I will admit we don't walk as often anymore. We rewarded ourselves, or I rewarded myself when I turned 65 to always ride when I play golf. But like I say, there have been really no issues up to that point. Now, 3 years ago, I was diagnosed, or I started having an issue with some arrhythmia problems. And again, the echo indicated that I could probably benefit from a pacemaker. And so I did have a pacemaker implanted 3 years ago. And also last year, I had to have an ablation procedure because I was having some issues with PVCs. But in both cases, the doctors, I specifically asked them, the doctors assured me that it had nothing to do with my mechanical valve.
Well, if I could stop you right there, Alan, sorry to interrupt. I just want to make sure you go 35 years without any cardiac issues. You have some arrhythmias, you have PVCs, and then you have some procedures to help out the rhythm in your heart, but not connected at all to the mechanical valve. Is that right?
That's correct. Absolutely.
Wow, amazing. And so now that you've had those procedures, how is the ticker doing?
It's doing well. I just had an echo in February, and I usually have one a year, and that echo, while my heart functions, and more specifically my ejection fraction, hasn't improved to the point that they would like to ultimately get it to. My valve functions are doing just fine. My mechanical valve continues to, I don't know if you're not old enough to remember the old Timex commercials, takes a licking and keeps on ticking. And that's what my valve does.
Well, you know, Alan, I'm going to surprise you. I do remember those commercials. So I'm glad to hear you continue ticking, whether it's related to a commercial or not. And obviously, if we are giving out degrees for patients in heart valvular conditions, you'd get a doctorate, Alan. And I've got to ask you, you obviously have advice for other patients out there who are going through this. And so let's talk about your advice maybe for patients who haven't had a procedure just yet. Maybe they're like you, maybe they're in watchful waiting. What type of advice would you have for patients that are getting ready for a procedure or monitoring their valve disease?
Sure. I guess the one piece of advice I would give prospective surgery patients would be, once the doctors make that decision that it's time, that you should have the surgery done, don't hesitate or don't procrastinate. Get it done. And the only reason I say that is because you're going to be amazed at how much better you feel. I know I thought before my surgery, that year before I had surgery, I thought I was doing just fine. I hadn't had any symptoms. I didn't have any shortness of breath. I had no chest pain. They would ask me how my energy level was, and I thought my energy level was okay. But then I had the procedure, and lo and behold, post-procedure, I didn't feel nearly as good as I thought I did, because I sure felt a lot better when it was over. So you know, if at all possible, get it done as soon as you can.
Great advice, Alan. And let's go ahead and let's flip the switch and let's talk about for the patients who have gone into recovery after a procedure. Obviously, you got 37 years of experience. What can you share with those patients as they have gone through the procedure?
Well, again, the one piece of advice, or maybe a couple of pieces of advice, would be to continue to remain under your cardiac care team's care. Even though you are going to feel much better, as I previously stated, and the temptation might be to start letting an appointment slide, or well, I don't need to see a doctor, my cardiologist this year, or whatever. See them regularly. They know what's best, and I'm certainly in no position to offer medical advice to anyone. I'm not a physician, but I saw my cardiologist religiously once a year, and my primary care physician twice a year. And then even the last 5 or 6 years, I've been seeing my cardiologist twice a year. And now I've added to the list my electrophysiologist as well. So keep seeing them. And when you do see them, be open and honest with your doctors. You know, they know what's best for you, and they can't treat you if they don't know the whole story. So if they ask you how you're feeling, you know, resist the temptation to just say, "Oh, I'm fine." If in fact you're not fine, if you are, that's great. Tell them so. But too many times, I know I've been guilty of it, where I've gone in to see a doctor, even when a friend asks me, "How am I doing?" and I'll say, "Oh, I'm good, I'm fine," and really maybe I'm not. So be open and honest.
I love the advice, Alan, for the patients out there. Couldn't echo those more, because these days you have to advocate for yourself. You have to go ahead and just monitor your heart after a procedure like this, and being straight with your team about what's happening with you does nothing but help everybody as we work together to ensure health. And, you know, Alan, as we wrap up here, obviously you've referenced St. Jude in your mechanical valve several times. Obviously, over the years, St. Jude, and actually just not too long ago, St. Jude was acquired by the team at Abbott. And I have just a question for you. Is there anything that you want to share to the medical team, the researchers, the developers of your mechanical valve, given all that you've been through over this past 37 years? Is there anything you'd like to share with that team at Abbott?
Well, a couple of things, Adam. First of all, I had great surgeons and a great cardiologist back in where I had my surgery done. It was in the Minneapolis-St. Paul area at a hospital called United Hospital. And as I mentioned, one of my surgeons was involved very closely with the St. Jude organization. And so he had a lot invested in it and had a great interest in it, and was a very skilled surgeon. But I would just like to thank St. Jude for all of the work they've done, not only in the mechanical valve space, but in the medical device space in total. And I'm sure that's one of the reasons why they became a very attractive target for Abbott Laboratories as a purchase. So again, I'd just like to thank them for giving me the quality of life that I've enjoyed for the last 37 years since surgery. And allowing me to do all the things that I ever hoped and dreamed I might be able to do.
Well, I think that is going to resonate with a lot of the patients out there who have this tremendous amount of gratitude and thankfulness for all the organizations, all the medical companies, and the doctors who've come together to support us through what can be a very, very difficult and trying time. And just as you've extended thanks to your medical team and to Abbott St. Jude, Alan, I'd like to extend a monstrous, humongous thank you to you for taking the time to meet with me. It's been great getting to know you over the past little while here. And I can't tell you how much I've enjoyed hearing your amazing story that has inspired me, it's touched me, it's moved me to know that if you can make it 37 years, hopefully I and so many other folks in our community can as well. So on behalf of our entire community at HeartValveSurgery.com, Alan, I just want to thank you today for your time.
Well, thank you, Adam. And if I could, before we leave, if I could also thank you for the tremendous service that you provide to this community, to this community of prospective and heart valve surgery patients and those who have received a heart valve. I only wish that something like this would have been available to me when I was going through the process of making the decision, do I have the surgery or not have the surgery, and what can I expect, and whatever. But the tools that you provide online are just amazing, and I've only scratched the surface, I know, in looking at them, but I'm looking forward to learning more about you and your organization.
Wow. Well, for me personally, Alan, you just made my day, you made my week, you made my month, you made my year, you made my decade with those comments. I can't thank you enough. It's a gift for me to be able to be of service to people when they're going through this very difficult, transformative time in their lives. So thank you for those very kind words. And then we're going to wrap up today, Alan. I just want to thank you again, as we always say here at HeartValveSurgery.com. Keep on ticking.
You got it. Will do.